Okay, we'll get started now then. Thank you so much, everybody, for coming today. I'm sure you're all very busy, so we really appreciate you coming along. So my name is Faye White, and I'm the Women's Health Officer at the National Women's Council. And the National Women's Council are running this event today in partnership with the Union of Students in Ireland. So essentially, what we're going to do today is kind of take you through the abortion review. So hopefully you'll all have a bit of background. But ourselves at NWC, along with USI and Sinead Kennedy, are members of the Abortion Working Group. So this is a group of civil society organisations and healthcare providers. And it was established in 2019 and is chaired by NWC. Within the Abortion Working Group, we decided to do a quick guide to the abortion review that is currently underway. So as you all know, it's been about 4 years since repeal, and there is currently a 3-year review of how the abortion law is operating, which is why we're here today. So we know that we need as many people as possible to contribute to this review. There's a public consultation open at the moment until the 1st of April. And we need as many people as possible to submit, and we know how important it is for students to be involved in this. So this is why we have this webinar today purposely for students. So we developed a quick guide to the review to make it as simple as possible for you to submit to the public consultation, which is what we're going to be going through today. So I'll take you through it step by step to make sure that you know what's on the form, how to answer things, and most importantly, what the information about abortion is in Ireland, and what's working well, and really importantly, what's not working well. So before I get started, I think it's important to give some context to the review and to repeal. So to do that, I'm just going to introduce my colleague Sinead Kennedy to give a little bit of context on that. Sinead is one of our colleagues in the Abortion Working Group and is the co-founder of the Coalition to Repeal the Eighth Amendment, and is also a lecturer in Maynooth University. So I'll just hand it over to you now, Sinead, to give a little bit of context.
Thanks very much, Faye. Thanks to USI and to the National Women's Council for organising today and for inviting me along, and for all of you taking time from your lunch break to come and listen to us today. So I just wanted, I'm only going to speak for just a very short period, just to give you just a small amount of context. I'm probably telling you a lot of things that you already know, because I'm sure many of you are the very people who were involved in building the repeal movement. But I do think it's important, we're going to be talking a lot today about the failures of the kind of post-repeal legislation. But I do think it's important to maybe take a minute and to remember our victory, and to remember the really important work that was done and the significance of the achievement of repeal. So as you all will remember, on the 25th of May, the Irish electorate voted by a landslide in favour of removing the Eighth Amendment. That was Ireland's constitutional ban on abortion from the Constitution. And the scale of the victory was enormous. And I think it took all of us who had been involved in the campaign for many years, it really took us, the scale of the victory took us by surprise. 66.4% of people voted yes. Yes to a new article stating that the provision will be made in law for the regulation of abortion. And it was very clear from the scale of the movement that built repeal and from the scale of the vote itself, that people wanted to have their say on abortion, and when they had an opportunity to have a say, they said that they trusted women and pregnant people to decide for themselves. And I think it's important that was the key message, I think, that was very clear from the repeal victory. The second thing is, I think the movement for repeal was one of the most important political and social movements in the history of the state, because it didn't just come from enlightened politicians. The energy and the dynamism of the movement, it came from tens of thousands of activists, people like yourselves, different groups and organizations across civil society, who, people from every corner of the island of Ireland. It was a campaign that was run largely by women. From the leadership of the National Together for Yes campaign, which included Orla O'Connor's director of the National Women's Council, right down to local campaign groups, people who'd never been involved in political campaigns, day after day, night after night, going door to door, talking to voters and making the case that women and pregnant people should be allowed to make these decisions about their own body for themselves. And I think the stories and experiences of people who'd had abortions and the difficulties and challenges of being denied access to bodily autonomy in your own country, being forced to travel abroad if you were in a position to do that, and there were many who were not, I think really kind of resonated with voters and with campaigners. So I think this public consultation is a really important opportunity for us to have our say about the laws that have been enacted, to say that yes, we're delighted that people can access abortion, but there's still too many unnecessary barriers, and that these need to be addressed so that the real spirit of the repeal movement is expressed in our laws and in our social values. So thanks very much.
That's great, Sinead. Thank you so much for that really important context, and for also reminding us of the positives and what a victory repeal was. And how much ground we've made over the past few years, and reminding us of the opportunities we have to make things better, and that we know that we can do that when we all come together. So thanks a million. If anybody has any questions on any of that, I'd invite you to unmute yourselves or just pop a message in the chat before we go on. But if not, I'll just introduce my colleague Buki Hadid-Bowale from the Union of Students in Ireland. So Buki is the USI's Vice President for Equality and Citizenship, and she will just give a little bit of an overview of why this is really important for students. So if you're ready, Buki, take it away there. I know Buki is having some internet problems, so might just give it a minute.
Can you all hear me? Yeah, no?
Oh, yeah, perfect.
Amazing. Okay, so I really, really hope that this goes through and the Wi-Fi does not let me down. But thanks so much, everyone, for being here today. And obviously I have to give a man with us on this piece. I think an important piece for us to kind of work on, because the history behind it is so powerful. So I'm just going to run through a quick spiel on the importance of your voice in this consultation process going forward. So I have a little slide show prepared for you all about the repeal review, essentially. And why are we talking about abortion again? And Sinead gave a really, really great it took place and how we voted in land decisions towards pregnancy and accessing abortion in Ireland. However, why we're here today again is because the abortion law that we have currently at the moment has fallen short in honouring that vote that we made in 2018. So what I'm going to do is dive into some student history, a little bit of kind of a mixture of what repeal has been for us and the Constitution, which essentially equated the life of an unborn child to the life of the person who's pregnant. And with that, we had a lot of history in student unions, and I'm sure some of you might know this, but if you don't know it, we actually had a history of student union leaders who essentially were dragged through the courts because they had circulated information in terms of accessing abortion. Did take a stance on doing this pivotal at that point in time, but we had a history of SUs being at the forefront of abortion access and abortion information, and that had been contentious at the point in time that it did happen. But we did, see that kind of change and make a stance that's affected what we're doing right now today, and it's kind of paved the way for us to continue our work. To the X case, so decision in the UK, but was stopped by the courts from traveling abroad. And again, we had the referendum on the right to travel and the right of information passed in 1992 as well. And then in 2002, we had the referendum on suicide as a ground for abortion rejected. And you can see that there's just so much history in us trying to fight so much for our access to bodily autonomy being denied. Where we had the death of Savita Halappanavar in the, and this really sparked a movement, and I suppose like not even an uprising, but it sparked unity across the country, in which so many groups came together to protest this, and we still honor Savita's death today, and we acknowledge that in our kind of work and repeal as well going forward. Then we had in 2013 Protection of Life During Pregnancy Act was signed into law, and then human rights bodies called Ireland Edge. So this is a lot of information, but I hope that you're keeping up with me. But in 2017 is kind of where we start to see a shift. Where the Citizens Assembly, and then 2018 with all the students, and not even just student unions, but the community support from different groups, including say the likes of National Women's Council, and beyond that, we all came together, we all fought, we all tested, and brought repeal to the forefront. And I think finally in that moment in time was where we really saw recognition of bodily autonomy for women and pregnant people. Moving on to just a brief piece on why we're all here today matters. The point to make is that Irish women and pregnant people are still traveling to access abortion care. And this is important to note because of the fact that we did have that monumental win in 2018. It was significant for us then at the time, but what we didn't realize is that we wouldn't have the spirit of that vote, and that yes honoured up until the different locations to access abortion care. And then there was a piece of data that was pulled up essentially saying that for young people in Ireland across the ages of 18 to 24 who had Irish addresses, so essentially were people who are from Ireland, were actually 1/4 of those were people who were accessing abortions in the UK. So that's really significant to note that there's just still, bodily autonomy access to abortion for young people and students. So we are already struggling as it stands in terms of accessing education, and the cost of travel and accommodation, and even paying for a service for abortion is important to note, and that it's not something that students can avail of, and it's not always something that's accessible to everyone. And even bringing into that migrants, asylum seekers, and undocumented, more barriers on top of that that are faced by people in Ireland already as it stands, if you fit in those categories. And so it's just at this point in time why we're here today is to be able to work through those processes and be able to put our voices down again in writing and keep kind of pushing the agenda of repeal forward, so that the right of Ireland at heart is taken into consideration here. I hope you could all hear me and see everything clearly. And if you didn't, I apologize. My Wi-Fi did not like me today. But I'm going to stop sharing my screen and then we'll kick off with the rest.
Thanks, Boogie, for that. That was really useful actually to have the history and just a reminder of particularly why this is such an important issue for students and for young people in particular. And we really hope that you all are kind of motivated to have your voice heard, regardless of what your experience has been with this thus far. So as I said, we know that like public consultations and things can be very inaccessible, very complicated language, and quite intimidating for people. So that's why we've developed a quick guide to doing your submission, which is what I will take you through now. I would encourage you again, if you have any questions, just pop them in the chat, and you can wait till the end either and we can have some discussion. But I'll just share my screen now and take you through the guide. Okay. Just double checking you can see that okay? Yeah, great. Okay. So we developed this guide, as I said, and it's split into two parts. So the first part is the practical things on what the review is and how do you make your submission. And then the second part is the information that you can use within your answers to answer the questions. So the part one is what is the review and how do I make my submission? So as Sinead and Buki have already kind of spoken about, it's a really important opportunity to have your voice heard. Repeal was one of the most important political and social movements in the history of the state, and it mobilized tens of thousands of activists from every corner of Ireland, of every age, background. It brought everybody together to just make the case that women and pregnant people should be allowed to make healthcare decisions for themselves. But the law that we ended up with doesn't honour the spirit, and we still have a series of obstacles that prevent women and pregnant people from accessing abortions. And these unfortunately disproportionately affect marginalised people and vulnerable people as well. So this public consultation for the 3-year review of the abortion law is the first opportunity that we have to review the law and look at how we can do better for women and pregnant people in Ireland. So it's a really important opportunity to hear people's voices, not just those impacted by the law, but people who care about this and think that women and pregnant people deserve better and know that we can do better, because we've seen through repeal what we can achieve when we all come together. So just to take you through what the law actually says. So abortion currently is allowed in these circumstances. So firstly, up to 12 weeks on request. So this is referred to as an early medical abortion. So this means that anybody up to 12 weeks can go to their GP and access abortion free of charge. There is a mandatory 3-day waiting period with this after the initial consultation. So that means somebody goes to their GP, they say they want to access an abortion, and they must then wait 3 days until they can get the abortion pills and the abortion begins. That is mandatory for all abortions under 12 weeks, and that is a strict 12 weeks and not a day over. And then above 12 weeks, abortion is only permitted in cases of a risk to the life or health of the woman or pregnant person, and in the case of a fatal fetal anomaly. So this means when the fetus will die before or within 28 days of the birth. So medical practitioners they don't have to carry out abortions if they object due to their personal beliefs, which is known as conscientious objection. And really crucially, it is a criminal offence for anybody to support access to or provide an abortion outside the scope of what is in the law. And that carries a sentence of up to 14 years. So just like before repeal, abortion is still being criminalised in Ireland, unfortunately. So the public consultation, what is it? So currently the Minister for Health is carrying out a 3-year review of how the law is operating. So that means what is happening in practice, what is going on in abortion services, how they're working, and are they working? And the Minister is looking for the views of the public to inform this process. So this is the public consultation is open to anybody. So whether somebody has had an abortion, been a patient escort, supported somebody through an abortion, are concerned that one day they may need an abortion, or may never need an abortion, but just want to be an ally to those that may. So as I said, we know that the consultation form itself can be quite intimidating. A lot of people go in and say, I don't know what this means, what I'm being asked here, and it really turns them off. So what we really want to try and do here is make this as simple as possible for you to go in, know what the questions mean and know how to answer them. So just on this slide here, I've just outlined what the questions are and how to answer them. So the first question here is, to what extent do you agree that the Act has achieved its aims? So this is just a question on a scale of strongly disagree to strongly agree. So you just choose one of 5 options on that scale on whether you think, based on your opinion and the evidence, whether the law is achieving its aims to provide abortion. The next question there is, are there parts of the Act which, in your opinion, have not operated well? So this is a yes/no question, and then there's a question box after it where you can elaborate with the evidence or your experience. So this question is looking to gather information about the problems with abortion and the barriers and the obstacles. So to answer this question, you can use the barriers that I will talk about in part 2 of this guide, as well as the statistics. And it is up to you what you include there. You don't have to include everything. And then the next question is, are there parts of the Act which, in your opinion, have operated well? So again, it's a yes/no question, and then you can follow up to support however you answered. If you don't think anything has operated well, you can answer no, and then again use the question box to elaborate on why you don't think abortion services are operating well. And then there are 2 final questions that provide an opportunity for further comments on, first of all, the operation of the legislation. So again, that means how abortion is being provided in practice based on what is set out in the law. So in this section, you might want to share a personal experience or a personal experience of somebody you know, or if you have an experience as an abortion provider or working in a healthcare facility that provides abortion, you can add that in here. You don't have to answer it if you don't have anything further to add. Finally, then, you can add a further comment on services provided under the Act. So that's another opportunity to share some details on how the abortion services are working, whether that's within a GP or a maternity hospital. So again, you can share a personal experience or that of somebody that you know, or if you have experience of working within services. So really importantly, the deadline is the 1st of April, 2022. So we have just over a month to get as many submissions as possible. And there are 3 different ways that you can submit to the public consultation. So there, you can submit an online form, which is linked within the guide, and we will put the guide in the chat and also send it around to all of you. You can download that online form and then email it to the Department of Health. This email address here with the subject line review of the operation of the Act. Or you can download it and fill it out, or print it, fill it out and post it as well to the Department of Health. So they do expect to publish submissions on the Department of Health's website, but you can indicate that you don't wish to have your submission shared. So I'm just going to move on to part 2 now. So this is the information about abortion in Ireland, and this is what you can draw on to answer those questions that I just went through in part 1. So I just wanted to highlight firstly some of the really key statistics, and a lot of which I think a lot of people aren't aware of. And the first one, which I think is quite shocking, is that only 1 in 10 GPs are currently providing abortion. So that's across Ireland, and it's really a very low number, 3 years on from when the law was enacted. And this is providing a lot of barriers for people who may have to go through multiple GPs to find somebody who will provide them abortion. They may have to travel quite far to access a GP who will provide an abortion. And in 2020, for every 3 women who and pregnant people who obtained an abortion because of a fatal fetal anomaly, 2 had to travel to the UK. So I'll talk about why that is in a little bit, but we do want to emphasize that there are a large amount of people who are still traveling for abortion care in Ireland, despite the legislation that we have. So 194 people from Ireland traveled to the UK for an abortion in 2020 in the context of a global pandemic. So putting themselves at risk, putting their health at risk to access healthcare that should have been available in Ireland. There's only 10 out of 19 maternity hospitals in Ireland providing full abortion services. maternity hospitals are publicly funded, which means that they all should be providing abortion. So again, this is just an additional barrier to people being able to access abortion. The Abortion Rights Campaign, or ARC, who are also a member of the Abortion Working Group, they conducted research last year with service users, and they found that 30% of respondents traveled between 4 and 6 hours to receive abortion care. So again, this is disproportionately affecting rural women or people who are in areas where abortion is not available. And then finally, almost 1 in 5 respondents from the same research were refused care. And this contributes to delays, which I'll again talk about in a little minute, but that's why we're looking for the limit to be extended. So as I said, one of the questions is about what has not operated well with the Act. So based on the available research and the evidence that we have and the experiences of many of the healthcare providers or support services within the Abortion Working Group, there are a number of things here which are not operating well with abortion in Ireland. So I'll just take you through these now. And as I said, you can include whatever you want within the public consultation form, but you can draw on whatever is in this section here. So the first one is the 12-week limit, which, as I said, is strictly 12 weeks and not a day over. And just to provide some context, 12 weeks pregnant is counted from the first day of the last period. So it's actually 10 weeks from conception. So a lot of people don't even realize they're pregnant until they're 5 or 6 weeks. And so there's a lot of reasons why this is a barrier to providing an abortion. So as I said, that mandatory 3-day wait adds another layer of delay to this kind of urgency of providing an abortion by 12 weeks. The lack of GPs means that there's delays if somebody has to go and contact multiple GPs trying to find somebody who will provide an abortion to them. There's a lack of information for adolescent girls or younger women who are pregnant and might not know where to get any information or how to get support in the event that they find out that they're pregnant. And really importantly, the impact of failed abortions. So a small proportion of abortions will fail with the abortion pill. And because of the 12-week limit, if, for example, somebody had an abortion at 11 weeks, they have to wait for 3 days, and then the abortion fails. Once they're over the 12 weeks and they find out the abortion has failed, they cannot access abortion. And if they still want an abortion, they will have to travel. It's really important to highlight that extending the limit beyond 12 weeks doesn't mean that more people are going to access abortion at a later point. The data from England and Wales, where the limit is actually double what we have, so it's 24 weeks, shows that in 2020, 94% of abortions were performed under 12 weeks. So we do want to stress that it's only in very rare circumstances that abortions are performed at a later term. So next, just for abortions post 12 weeks on the grounds of the risk to the health. So these can be provided if there's a risk to the life or serious harm to the health of the person who is pregnant, or in the case of a fatal fetal anomaly. However, what we do know is that there's very low numbers of abortions after 12 weeks. So what this suggests to us is that it's being interpreted in a really narrow way. And as I said before, because healthcare providers are criminalized still, that leaves this kind of gray area for how this is being interpreted, and doctors don't want to risk, becoming criminally liable. So most women who travel abroad for abortions after 12 weeks do so because the risk their pregnancy faces to their health, or in the case of a fatal fetal anomaly. So it's really concerning, and it also just confirms to us again that the abortion services are not doing their job and people are still not able to access them. So then in the case of fatal fetal anomalies, so for an abortion to be provided above 12 weeks in the case of a fatal fetal anomaly, 2 doctors have to certify that the fetus will die within 12 or 28 days of birth. So in a lot of cases, medical practitioners can say that the fetus will die quite soon after birth, but it's very difficult to say that it'll be within 28 days. And again, that has to be 2 doctors that sign off on that decision. So as a result, many women are still unable to access abortion. And in 2020, 63 women had to travel to England and Wales, and an unknown amount had to travel to other countries to access abortion because of a fatal fetal anomaly. The 3-day wait for abortions under 12 weeks isn't based on any medical evidence or research, and it's a barrier to urgent care, and again just delays access to abortion. It puts stress on women and it undermines their autonomy and their ability to choose for themselves, which is what we talked about before, and what repeal was all about, was giving women and pregnant people that power to choose for themselves. So it's really contrary to that, and it's also contrary to the World Health Organization's guidelines on abortion. And the criminal liability for practitioners, abortion is healthcare, and it is recognized as healthcare by the World Health Organization. Despite this, there is a maximum sentence of 14 years for any medical practitioner who provides or assists with providing an abortion. This is really chilling and just undermines doctors' clinical judgment and their professional expertise, and we feel strongly that this should be removed. Safe access zones. So anti-abortion activities is happening outside of maternity hospitals and clinics and anywhere providing abortions currently. Unfortunately, there's really strong evidence that this has a really distressing and traumatizing effect on women, as well as the staff who are providing the care and any members of the community and the people that support them. So safe access zones were promised in the referendum in 2018 and must be delivered. Together for Safety is a member of the abortion working group who've done a lot of work on this. So if you have any particular interest in that, I'd suggest that you look up Together for Safety's work on that. The poor geographical coverage, as I said, there's only 1 in 10 GPs who are providing abortions. And in some counties, there's no GPs at all who provide abortions, which means that somebody has to travel to another county. So in combination with a 3-day wait under 12 weeks, this means that if some people may have to travel twice if the initial consultation cannot happen over the phone. So this disproportionately affects rural women. There is a lack of monitoring of conscientious objection. So it's illegal for institutions like maternity hospitals to conscientiously object to abortion. So although individuals can object to it, they must provide a referral to somebody else who can provide it. However, because only 10 in 19 maternity hospitals are providing abortion, it does suggest to us that conscientious objection is a factor in why there is poor hospital coverage. Again, this just causes delays in accessing abortion, and it is contrary to the Irish Medical Council guidance. Lack of data. So although we do have the stats that I talked about, good quality data is really, really essential to monitoring and evaluating services. We do not have a national database or anything that captures things like refusals of abortion care, how these cases were referred to alternative care, breakdown of abortions by location or type of abortion provided. Moving on then to providers of abortions, there is a lack of trained healthcare providers in Ireland, which is yet another barrier to care. The current delivery of abortion care is kind of restricted to doctors, whereas evidence from other countries says that nurses and midwives can also safely provide or be involved with providing early medical abortions. There is a PPS number requirement to access free abortions, so they can only be provided to people who have a PPS number. So a lot of Irish residents don't have PPS numbers, and particularly for international students who would not have a PPS number, this means they cannot access a free abortion and they would have to pay. So other people that has an impact on would be asylum seekers, residents in Northern Ireland, and anybody temporarily living in Ireland. So In practice and anecdotally, we know that this means that some people may be forced to travel. If they don't have money to travel, they may be forced to continue with the pregnancy. And again, anecdotally, we know that for some international students who may not be able to get a visa to travel to a different country, that puts them in a real bind there about what to do. And then finally, translation. So there is a lack of interpreters for service users, which is a huge challenge for a lot of people who are pregnant and want an abortion, and is a barrier to them communicating their needs and also to understanding the abortion process and the pathways of care there and what's to be expected. So now I'll just talk about what is operating well, which is another one of the questions on the form. So we know that telemedicine for abortion care has been introduced in the pandemic. So this means that there's been telephone and video consultations introduced. And this has been really positively received, particularly by the disabled community and for women in rural areas, because it means that they don't have to travel to have the consultation with their GP. It also gives them more privacy if they have kind of so they don't have to see people in the doctor's waiting room or anything like that. So this has been really well received in the research that's been done, and definitely is something we would like to see continuing beyond the pandemic. I do want to emphasize that healthcare providers are often really positively received, although there are a smaller number of GPs and healthcare providers who are providing abortion. We know from studies such as by the WHO that service users report really positive experience with their healthcare providers who provide them with compassionate care, and that they do understand the urgency with providing abortions. And then just finally, the experience of My Options, which is the national free helpline where people looking for an abortion can call, and they can get the name and phone number of the abortion providers which are closest to them. So there is a problem with a lot of people being unaware of this service and not being able to know where to look for it, but the people who do access it have really positive experiences of My Options. So as I said, those kind of barriers to abortion care and the things that are working well are all drawn upon by research that's been conducted. So I just want to highlight them for you here, and if anybody wants to do some further reading or to pull out some more things from these papers. So the first one is just the Abortion Rights Campaign, which published a report in September there about too many barriers, experiences of abortion in Ireland after repeal. The National Women's Council's own research that we published about a year ago about accessing abortion in Ireland. There's also an upcoming study by the World Health Organization, which I've just put the details of here. They haven't published it yet, but you should be able to access that soon enough. And then also the WHO Safe Abortion Guidance for healthcare systems. So I just want to thank Sinead and to Buki and USI for their support with this guide, and to Alana Ryan, who's our Women's Health Coordinator in the National Women's Council. If anybody has any questions about anything, please feel free to contact me at faw@nwci.ie, and we will put this the guide in the chat. So I'll just stop sharing my screen now. Yeah, so it'd be great if we could have any questions or discussion, if anything was unclear there to anybody about how to make the submission or what the review is, or if you have any questions about abortion and abortion services, we would be really happy to take them now. So feel free to put them in the chat, or just unmute yourself or put your camera on, or whatever you feel most comfortable with.
Faye, I think that there's a problem with the chat. Could we enable it? I think it's, yeah.
Sorry about that. Okay, that should be working now.
Brilliant.
Okay. So I'll just put the guide in the chat, and then the links. Thanks, Bookie. The link to the consultation form and everything is in there, and that further reading is in there as well. So as I said, I think it's really important that we get as many voices from diverse communities and a diverse range of voices to submit to this public consultation. And I think students' voices are really, really important. And you know, I hope that this was helpful for those of you who did attend today, and it would be brilliant if everybody who is here today could just kind of commit to saying to like 2 or 3 friends, sending on the guide and encouraging them to submit as well. Like I say, you're free to put whatever you want within the form and add, you know, however much you want. There's no correct way to say it either, you know, don't feel obliged to use the same language that we've used. You can put it in your own words. This guide is just here to help you understand what the process is, and to know where to look for the information really, and to know what the important points are. So yeah, I think that's an important thing to say, that there's no right or wrong way to go about this, but just ensuring that your voice is heard is the important thing, so that we can hopefully improve abortion access and, you know, really just take this opportunity, which, as I said, is our first opportunity since the law was enacted, to try to improve things for the better, which we know that we can do and which we have done already.
And just to really underline that students have had such a huge impact on Ireland's reproductive rights, as Bookie was saying. You know, there's a huge history of student involvement and support for women's and pregnant people's bodily autonomy. And a lot of the progress that we've seen is because students have galvanized and worked together and got the message out. So really and truly, if everyone can tell 2 or 3 people about this, and really just talk about the issues. It is just 1 in 10 GPs. It is only 10 of our 19 maternity hospitals. You know, this is something which has been promised since 2018, yet in practice, the rollout is slow and it isn't delivering care for everyone who needs it. So we really do need as many submissions as possible. And it won't take long, but it will make a big difference. So please do get the message out.
Thanks, Alana. And just to highlight as well that, you know, this is important beyond the 1st of April and beyond when the public consultation is closed. This is an ongoing conversation that we need to be having. And I think, you know, a lot of people thought that once repeal was over and once we had repealed the 8th Amendment, that this was just done and you know, we had abortion and it was all fine. And we need people to know that like this is happening and this is traumatic for a lot of people, and that abortion is healthcare, and that they should be able to access it here free, you know, somewhere that is local, and in a way that is legal. So this is an ongoing conversation. This does not end on the 1st of April. So I just want to say that as well.
And maybe just before we finish, if people felt comfortable, it would be great to just put a photo up on our social media. And I know USI would like to do the same as well. And so if you did feel comfortable about turning on your camera for a quick photo, I think that would really help to kind of support with the digital side of this. And yeah, it'd be great if you did feel comfortable, no pressure. Super. I'll give it a second in case anyone else is. Okay. Brilliant. Thanks so much.
Thanks, Alana. So yeah, the guide is in the chat and I'll also email it around to everybody who is here. Please feel free to contact me by email if you have any questions. If you have any friends or anything that want any more information, we're on hand to provide any support that we can. But thank you so much, everybody, for coming today. We really, really appreciate it. And it's really encouraging to see that people are interested in this and want to get involved. So thank you so much to everybody. And again, to Sinead, Bookie and Alana. And we have been recording this as well, so the recording will be available afterwards. Okay, thank you so much, everybody. Hope you enjoy the rest of your day. Bye.
Bye.